As with all medical fields, new technologies and tools can come in handy for a more individualized approach to meeting each patient's needs. Here to discuss specialized physical therapy treatment from Lake Charles Memorial Hospital, medicine and outpatient rehab, we have Lauren Barron. Thanks for coming in today.
Anytime. Thanks for having me.
And you've brought what look like ninja weapons in today to show us. We're not really sure what this is, but you've got these tools that you're using to help people feel better and get through their therapy. What are these?
These are instrument-assisted soft tissue mobilization tools.
Sounds complex.
It's not.
Okay.
Basically what these do is you put them on the skin and they, depending on how fast you rub them and how deep you rub them, they stimulate certain receptors in various areas of the skin, and then they send a message to the brain to get a response. It's very similar to if you were walking and stepped on a stone or a rock that would put input on your skin, and your brain would say, "Oh, gotta step back, don't want to step on that."
Okay, so you said it's kind of almost like when you bump your elbow and you
Yes,
rub it to make it feel better.
exactly.
It works that way too. What do you use these for? Is it for all areas of the body, or are there specific injuries that you're treating with this?
You can use it, so many patients can benefit from this. I use it on my ACL reconstruction, my young athletes that have some muscle inhibition after surgery. You can use it to activate certain muscles before they exercise, chronic back and neck that have those just tight, guarded muscles to kind of help relax that. You can even use it on post-knee surgery. It does fluid movement to get some of that swelling out.
Okay.
And I've even used it on neurological patients that have tight tone to try to help relax some of that.
Okay, so it does a lot of good for a lot of different areas, and you're going to kind of rub my arm a little bit with it here. You do a lot of different things with it. Some of it you said is real light and feels great, and then some of it's a little deeper, because I know we're not going to pretend that therapy isn't a tough thing, because
No.
it can be a lot of work, but it's so important to get that range of motion back.
Yes, ma'am. It
All
is
right.
indeed. So I can demo on you here.
Okay.
I'll use the light one. How
Use the
about that?
light one. All right. And you just use it right on over the muscle.
If we were actually in the clinic, I'd obviously be doing it directly on your skin.
Okay.
So for pain, if you came in and just had a spot that was really bothering you, if you had tendonitis or neck pain, back pain, you just kind of get on the area and you just go real light, just super feather light touch.
Very gentle.
Yes,
Okay.
make you feel good.
And then you get deeper to work on
Yes,
some
if
other
you were
problems.
doing muscle activation, you'd push a little bit deeper and still go fast to help stimulate those receptors, get them firing. Muscle inhibition is a little more hairy.
Okay. A little bit deeper
You would
still.
push a little bit deeper and you would go super slow. If you had an area that was particularly really bothersome, you can kind of chop to kind of break some of that up, which some people find kind of uncomfortable. And then if you were doing fluid, you would just kind of be scooping, making a scooping motion to kind of push it upwards to let it drain.
Almost like a massage kind of an idea, but it just
Almost.
works a little bit more specific to those areas. And like you said, works on a lot of different things and helps with a lot of different issues
It
that
does.
people
It
face.
really does.
All right.
Yes, ma'am.
Well, if you'd like to find out more about, I'm going to read it all out, instrument-assisted soft tissue mobilization. That's a lot
Very
of
good.
words.
I'm very proud of you.
Thank you very much. I have a degree now
You
in,
did
in
great.
physical therapy. You can give them a call at Lake Charles Memorial Outpatient Rehab. You see the number there on the screen, and they can give you more information about getting in and working on some of those problem areas. Thanks for coming in.
Thank you for having me. I appreciate it.
Had a lot of fun getting my arm rubbed. All right.